2010, the US government passed the Patient Protection and Affordable Care Act, known as Obamacare. A major part of implementing the law was the concept of a health insurance exchange where people could shop for their own healthcare insurance and compare different policies. Each state was responsible for setting up their own health insurance exchanges. However, many states refused, so the federal government was left to set up the exchanges for these states. In October 2013, 3.5 years later, Healthcare.gov launched, and did many of the state exchanges. The launch of Healthcare.gov demonstrated, in a very high-profile way, how software development projects can fail in spite of very high-profile backers, very large budgets, and lots of time. In May 2014, Jay Angoff, former director of Health and Human Services, produced a report on the cost of the health insurance exchanges. Jay Angoff found that the cost for the 15 exchanges built by the states was $3.9 billion to the federal taxpayer. The cost of Healthcare.gov was $3.5 billion. And by September 2014, the cost of the health insurance exchanges will be over $8 billion. This is an enormous amount of money for health insurance shopping websites. So let's discuss, in a simple and illustrated way, how to deliver a product like a health insurance shopping exchange with a fraction of the budget and half the time. The techniques I will present are very similar to the techniques used at Salesforce, Google, Spotify, Amazon, and many other companies where software development is a core competency. I'm Robin Diamond, and I have 24 years experience in software development and management. And I teach people how to deliver software products in short cycles using lean and agile principles and methods. I've helped implement these ideas in companies in Canada, Europe, and across the US. One of my clients uses these ideas to implement software for 1,600 hospitals in Europe. So, let's get started.
We need to start with the vision and goals for the product. As we learn and develop the product, the vision will help us make the required day-to-day and month-to-month trade-offs on what to build. From the Healthcare.gov website, the vision and goals are stated as: the marketplace is a new way to find quality health coverage. It can help you if you don't have coverage now, or if you have it but want to look at other options. With one marketplace application, you can learn if you can get lower costs based on your income, compare your coverage options side by side, and enroll. This is a good vision. It simply and clearly portrays the value of the health insurance marketplace for its users. The next thing we need is a business plan. Every product development investment should have a business plan, including government projects. The business plan gives the reasons for the investment, the economic model, the expected return on the investment, and the key business value drivers. This information is critical to help prioritize and deliver the highest value functionality first. The Affordable Care Act is based on the very real need to reduce healthcare costs and increase healthcare service levels for all Americans. However, after much searching online, I have yet to find a business plan for the Healthcare.gov website or for any of the state health insurance exchanges, so we'll proceed without it, and I will mention where it would be used. With the vision and the business plan, we know the product will deliver value to our users and stakeholders. So how to deliver this value? At this point, the traditional management approach, used with most of the health insurance exchanges, and the management approach used by Amazon and eBay take very different directions. Comparisons have been made between Amazon and the Healthcare.gov site. To manage the process of delivering new features and services, Amazon uses a popular Agile method called Scrum. Scrum is a simple framework to manage the process of delivering software in short cycles. So what does Scrum look like? Here's a high-level overview of the Scrum cycle. At the beginning of the cycle, we have a group of stakeholders, including users, customers, and sponsors, who are interested in what the product will provide. In the middle of the cycle, we have a small, cross-functional, and self-organizing team, or multiple teams, who can deliver completed software features. At the end of the cycle, we have the features the teams have completed. Now, since software is hard to specify and easy to change, the stakeholders review the completed features to give feedback to the team and to learn what should change in their planning, assumptions, and the product. This cycle of request, build, review, and revise occurs every couple weeks. So every 2 weeks, there are new completed software features to review and provide feedback on, better understanding of what to do next, and additional learning about the process of developing the product. The cycle repeats like clockwork, and the teams and stakeholders are done when there are no more features needed. That's a high-level overview of Scrum. Now let's see what it would look like if we use Scrum for building a healthcare insurance exchange. The first step is getting the group of stakeholders together to discuss what the health insurance exchange should do. These stakeholders have differing needs and interests. Often, one of the stakeholders has a deeper understanding of the product and user needs. That person would make a good product owner. The product owner's main goal is to ensure the software delivers value to users and provides a return on investment to the organization. So a strong vision for the product, a good business plan, and informed, engaged stakeholders can really help. To support the stakeholders in the team, the product owner maintains the to-do list for what the team will build. It contains all of the features we think we need to build. It is a dynamic list, with things being added, removed, or reprioritized based on the information we have at the time. In Scrum, the to-do list is called a product backlog. The product owner has the final say of what goes in the product backlog. They use business value, risk, effort, and dependencies to prioritize and order the product backlog. One of the goals of Scrum is releasing software to users early and often to check whether our assumptions are correct or not, and the product owner looks for ways to make these releases happen. In the backlog, we have the basic functionality we expect the healthcare insurance exchange to have. Users can log in or add a new account, complete a detailed profile and have that profile validated in some way. They can find and review insurance policies that they're eligible for. They can select and apply for the policy, and they can get updates on their application status. These are basic high-level features the system needs. Note that this list is neither complete nor is it very detailed. However, it is enough for us to get started. Now at the top of the backlog, we have login and user account. These are high-level ideas, so the product owner adds additional details to clarify what he wants the team to build. These are basic features and good ones for a new team starting to work together. As users of the internet, you should recognize these login and account features. Now that we have the detailed features in our backlog, the next step in Scrum is to take the top items off the list and build them. This is the job of the team. Scrum teams are small cross-functional groups who can take items from the backlog and turn them into working, tested features our users can use. Teams include people with a mix of skills, not just programmers. Other skills include testers, user interface designers, technical writers, and analysts. Basically all the skills you need to complete a software feature. In the case of Healthcare.gov, having analysts and testers who really understand the health insurance process would be important to a team's success. Scrum is a pull system. The product owner says what is most important, and the team pulls the top items to work on. Since the team is delivering the features, they do the planning and decide how much they can complete in a 2-week cycle. We wouldn't want a manager telling a doctor how to treat an illness, so we don't want managers telling software development professionals how to do their jobs. Instead, we want teams who are exposed to lots of good information and have the authority required to do their jobs most effectively. Now, Scrum has one other role, and that's the Scrum Master. The Scrum Master facilitates the Scrum framework, the meetings, and ensures Scrum is used correctly. The Scrum Master coaches the team, the product owner, and the organization in Scrum and Agile process and culture. It is a role that enables a transition from a traditional management mindset to a highly effective lean and agile management mindset. At the beginning of the planning meeting, the product owner and the team discuss the product backlog and these detailed features. Most of the time it's just clarification. However, occasionally there'll be features that the product owner is not clear on and the team is not clear on. So those items go back to the main product backlog for further analysis. Now the team can start doing their detailed planning for the 2 weeks. In Scrum, we prefer highly visual ways of planning and tracking our progress. So in this case, we're going to use Post-it notes for doing the detailed plan for each of the features. So on this whiteboard, we have the features on the left side and the tasks to build it on the right. Each team member contributes at different tasks that they think are required to get that feature done. So you'll see tasks like testing, programming, planning the testing, reviewing code so that you have good quality, and you'll also see scripting automated tests. This is important because as we move forward, we don't want testing to become a huge burden for the team. Now let's lay out the whiteboard for managing our work. We're going to have 3 columns: not started, work in progress, and done. Tasks are going to move from the left side of the board to the right side of the board. This allows visual management of our work. The team continues to discuss and then plan what it takes to build each feature and get it to a state where it's working and tested. You'll notice that there's Write the Test Plan, and this task also appears in the first feature. So you'll start to see a pattern: testing, coding, database work, help documentation, code review. The effort to implement each feature varies, but each feature requires similar kinds of work to be done. In this one, you'll even notice there's one called Set-Based Design. So that means the team doesn't really know exactly how they're going to code it, so they're going to try coding it 2 different ways. And of course, we need to get our testing in. The team continues to task out all the features they feel they can get done in the next 2 weeks. Now this last task, figure out how to make a unique ID, the team is not quite sure how to implement this, so they're going to do a spike, which means basically research. The team's going to do the research to figure out how to implement this feature in the future. A couple of features, Spanish language support for accounts and social security number, the team just does not have time to get to in the next 2 weeks, so those get put back on the to-do list. With planning done, the team can now focus on executing their plan to deliver the completed features. The team works collaboratively, often co-locating in the same room to speed communications and maintain a sense of shared purpose and ownership of the work. The task board is organized from the most important feature at the top to the least important feature at the bottom. The team will focus their efforts on delivering the features in this order. Remember, our goal is to take all the work from the not done side of the board to the done side of the board. Note that there is no one assigning work to team members. They select the tasks, put them in progress, and sign up for them. In this way, the team knows what everyone is working on. If a stakeholder wants to know, "Are you done yet?" the team can simply point them to the board to get the latest status of the features. And rather than starting lots of tasks, team members work on 1 or 2 things, focusing on completing the tasks they have in progress. If I go to a factory, I can see materials on the production line being shaped into the physical product. In software development, where do you go to see the work in progress? Software development is done in people's heads, and the result is changes to code files, test plans, screens, and documents. The work is abstract, and it is hidden from most people. By using a task board, we make progress in software development visual and easy to understand for everyone, especially for the development team doing the work. Within a couple days, the team has completed their first feature, the login. Since the team and product owner work together on a daily basis, they show the feature to the product owner to get feedback and ensure the team has met the product owner's expectations. Since this is still early days in the product development, we are more concerned with getting things working than making them pretty. The team moves on to the account features that make up the bulk of the planned work. The process is the same as for the first feature. Team members pick up tasks and complete tasks. They collaborate, find and resolve problems, and work together to deliver working, tested features. The team has just completed the account feature, and they show it to the product owner for feedback. And this gets the product owner thinking about what additional features are needed in accounts. As features become more complex, this exercise is very helpful for clarifying the product owner's detailed understanding of the system. Once the team has completed planning for the 2 weeks and is executing this plan, no new features are added to the 2-week plan. Teams need stable priorities and a stable, detailed plan to work. So the product owner adds new features and ideas to the product backlog, not the team's plan. Every 2 weeks, the product owner can signal to the team what are the next most important features, and every 2 weeks the team delivers the next most important features. This is the balance between speed and flexibility that Scrum provides. At the end of 2 weeks, the team has completed the work cycle and has features they can demonstrate to the stakeholders. The team conducts a review meeting to demonstrate all the features developed and to talk with the stakeholders about how the product is shaping up. Even if the team has not completed all the work, we still stop after 2 weeks. Having a regular 2-week cycle creates a heartbeat of delivery in the organization. The cycle also serves to surface problems, such as delays or access to resources, so they can be addressed quickly. Since the product owner is working with the team on a daily basis, he has already seen all of the deliverables, so there are no major surprises. Here, we see the stakeholders receiving a demo of the account features. The team shows that accounts are working and that they can be edited and the changes saved. Stakeholders can offer feedback to the team about the features, and the team can discuss their thoughts on how the features are working and insights they have had. In my experience, most innovation comes from the team. They are spending months trying to solve problems and create the system, so they are in the best place to come up with interesting ideas and solutions. One of the things we want is feedback, so we will often give our stakeholders access to the systems we are developing, so they can go in and try out the software. I wonder how many managers for the various government agencies or their contractors actually tried to use Healthcare.gov before it launched. In Scrum and Agile, value delivered through working, tested software is our primary measure of progress. After the product review and demonstration, the product owner, Scrum Master, and team meet to discuss the process of doing the work. This is an opportunity to find changes that they can make to improve their effectiveness. They discuss what is working, what needs improvement, and what can be done differently. This meeting, called a retrospective, is a key part of Scrum because it enables continuous improvement throughout the life cycle of the product's development. It allows the team to raise important issues and provides a mechanism to address difficulties that are both internal and external to the team. The Scrum Master plays an important role in ensuring these meetings are effective and then following up to ensure improvements are implemented, like organizing training and automated testing. And that is the final step in the Scrum cycle. At this point, we simply repeat the process of planning, making, review and feedback, and improvement. So every 2 weeks, the team and the stakeholders review the latest features and share the additional learning. The stakeholders and product owner use this new knowledge for adjusting their plans, coming up with new ideas, and discarding old ones. There is one more important cycle, and that is releasing the Healthcare Insurance Exchange to users. The product owner and stakeholders continually discuss what is the minimum viable product for the first release. They develop a release strategy to manage risk and increase feedback from real users. The first version of the exchange will have a limited set of features that are available to a limited audience. The goal of the first release is to better understand what real users think of the system and to expose technical defects that are often only found when a website is put into production. In this example, the Health Insurance Exchange is first released in July 2010, and the first users are residents of Pennsylvania who can register and review policies available to them. The team also launches a blog where they provide regular updates about the progress of the site to the public. This cycle of incrementally updating the Health Exchange with new features occurs every 1 to 3 months. It allows the team to gradually scale up the website's capacity while scaling up the number of users and insurance partners. Implementing a health insurance exchange using these tried and tested ideas would result in a site that delivers the highest business value for users while minimizing waste and cost for the taxpayer. Releasing new versions every 1 to 3 months would allow a gradual rollout that increases the user base without overwhelming the system and allows partners like insurance companies to integrate changes on their side gradually. The result is a better solution that is developed faster and more effectively with greatly reduced cost. These ideas are simple and powerful. However, implementing them is often hard. It requires a mind shift from believing that we can plan all the work before we do any work to knowing that predicting the distant future in complex product development introduces huge, multi-billion-dollar risks. In reality, it is much safer to minimize the amount of untested assumptions by building these systems in short cycles, like they do at Amazon and many other companies. I hope you liked this talk. Please subscribe if you're interested in future videos. There are topics I did not cover in this video, like architecture, planning, and governance, and if there's interest, I can do a part 2 and part 3. If you are looking for training for yourself or help for your organization, please contact me at scrumtraining.com or innovel.net. Thanks.